This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate. This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate.
This is the California State Senate.
Okay. Got everyone here? All right. Okay, well, good morning and thank you for being here today. We are here together this morning to announce a multi-legislative effort that has one goal in mind: to save lives. Together, we want to raise the tobacco tax, keep tobacco out of the hands of young people, regulate e-cigarettes and smokeless tobacco in our ballparks, and expand access to health care for low-income Californians. And before I get started, I just want to recognize and thank the authors of these important pieces of legislation. And I'm honored to be working on this legislative package with the chair of the Senate Health Committee, Dr. Ed Hernandez. Thank you. The chair of the Senate Budget Committee, Senator Mark Leno. The chair of the Assembly Health Committee, Assemblymember Rob Bonta. And the chair of the Assembly Budget Subcommittee 1 on Health and Human Services, I know that's a mouthful, Assemblymember Tony Thurman. And I'd also like to take a moment to recognize the extraordinary coalition that has come together to support these bills. Doctors, nurses, healthcare professionals, unions, advocates, and patients. This group has joined together to fight big tobacco because the toll that tobacco continues to exact on people is staggering. Tobacco use is the #1 cause of preventable death in the United States and around the world. Here in California, tobacco-related diseases claimed over 40,000 lives per year and cost taxpayers $18.1 billion annually, or $487 for each resident each year. I'm authoring Senate Bill 591, which will increase the California's tobacco tax by $2 per pack. We know how to win the fight against tobacco. Raising the tobacco tax has been proven to prevent and reduce smoking, especially among young people. In fact, we know that every 10% increase in cigarette prices reduces youth smoking by 7% and total tobacco consumption by 4%. And here in California, we have one of the lowest tobacco tax rates in the country, even lower than Texas. 32 other states have higher tobacco tax rates than here in California. An increase of $2 per pack would put California's tobacco tax rate as only 8th in the nation. And the money raised by the bill, $1.5 billion in the first year alone, will expand treatment for Medi-Cal patients with tobacco-related illnesses and support programs to prevent smoking. SB 591 is one piece of this very important legislative package. And before I have Assemblymember Rob Bonta speak about his legislation, I would like to bring up Laura Tyrell, a survivor, a fighter, to speak about the very real effects tobacco has had on her life. Laura?
I would also like to thank you today for joining us with this Save Lives California Coalition as we rally to support this unprecedented package of tobacco bills. These are 5 critically important pieces of legislation with momentum that is picking up as we realize what a huge dent they could make in the tobacco-related challenges we face on multiple fronts here in California. My name is Laura Terrell. I'm a 3-time cancer survivor. I'm a volunteer ambassador with the American Cancer Society Cancer Action Network. But today I'm here because I'm the daughter of 2 longtime smokers who paid the ultimate price. My mother and father both died from lung cancer at way too early an age. My cancers are unrelated to tobacco, but I've endured multiple rounds of chemotherapy, too many surgeries, and now I'm in a clinical trial fighting for my life against a stage 4 cancer. That is why it is absolutely mind-boggling to me when I see young people smoking, ignoring the risks that this has to their health and those around them. If you smoke, your chances of getting cancer increase by 30%. It isn't just about lung cancer. We now have found relationships with 14 cancer to tobacco use. 1 in 3 women will get cancer, and chances are even higher for you men, 1 in 2. Who would want to increase their odds? We know almost 70% of current smokers want to quit completely, for good reason. I know how hard it was for my mom and dad to quit. And of course, by the time they did, it was too late. It has been proven over and over again that by raising the tobacco tax, such as the $2 per pack proposed by Dr. Pan's SB 591, it's the most successful way to prevent kids from starting to smoke. Studies have shown that if we can keep them from smoking as young people, they won't smoke when they are adults. Now it's time to raise California's tobacco tax. We are only one of 3 states in the U.S. that has not increased that tax during this century. At 87 cents, you heard Dr. Pan say we are lower than the majority of the states. 33rd lowest in the country, to be exact, and that is simply shameful. Smoking inflicts a huge toll on California, both in terms of public health and our economy. Revenues generated from our tobacco tax increase would directly bring down costs by reinvesting in the state's anti-smoking programs that prevent youth from smoking and providing cessation programs for the people that want to quit. Smoking rates are not dropping like they used to, and in some cases, as with the e-cigarettes, they're actually on the rise. There is so much at stake here. Smoking kills more people than AIDS, alcohol, murder, car accidents, suicides, and illegal drugs combined. If my parents were here today, they would be at this podium instead of me, pleading with all of you that it simply isn't worth it. Tobacco isn't worth it, and we must get behind this very important coalition called Save Lives California, and every one of these 5 tobacco-fighting bills. If my parents were here, they would look at you and say, get on with it. Let's not lose ground. Thanks so much.
That's okay. Good morning. I'm Rob Bonta. I'm honored to serve in the California State Assembly, representing the 18th Assembly District, which includes the great cities of Oakland, Alameda, and San Leandro, and also very proud to serve as the chair of the Assembly Health Committee. I want to thank all of you for being here and thank the Save Lives California Coalition of doctors, nurses, patients, survivors, hospitals, healthcare workers, unions, and taxpayers who have all come together today to speak with one voice and stand up for the health of Californians. In my role as the chair of the Assembly Health Committee, I'm very proud and grateful to have the opportunity to work on numerous issues that improve the lives and health of Californians. And today, I'm very proud to stand with my colleagues and allies in support of a number of bills that will curb the devastating health impacts of tobacco in California and set a new precedent for other states to follow. Cancer, heart disease, stroke, lung disease, diabetes, and other diseases related to tobacco are a significant burden on California's already overstressed healthcare system. Every year, California spends over $3.5 billion in taxpayer dollars to treat Medi-Cal patients with tobacco-related illnesses. As Dr. Pan discussed, SB 591 will increase the tobacco tax by $2, and I'm very happy to be a principal co-author on that bill, as well as to be working with Dr. Pan on a companion bill that I'm authoring, AB 1396, which will allocate those new tobacco tax revenues to several purposes. AB 1396 will, 1, supplement tobacco prevention and control programs, 2, ensure quality and provide access to healthcare programs for families and children, including an increase in Medi-Cal reimbursement rates, 3, increase compliance with tobacco tax laws and reduce underage tobacco use, and finally, backfill any losses to programs currently funded by tobacco tax revenues. I'm proud to take a strong stand with the Save Lives California Coalition to save the lives of countless Californians from the preventable and destructive consequences of tobacco use. Thank you all for being here. I'm proud to stand with you. And next, let me introduce Chair of the Senate Health Committee, Senator Ed Hernandez, who will talk about his SB 151.
Well, good morning, everyone. Let me first start off by thanking the press for being here, all in the audience who are here as well, but also to take this opportunity to thank Save Lives in California Coalition as well. But take it a step further, but to also thank the members that are behind me who are committed to making a change in the state of California. Senator Richard Pan for his introduction of SB 591. I'd like to thank the Assembly Member Rob Bonta and for introducing AB 1396. I haven't seen Senator, oh, he just arrived. I'd like to thank Senator Leno for introducing SB 140, and of course Assembly Member Tony Thurman for introducing AB 768. And this is a series of bills that's going to affect how not only young adults, but how individuals in the state of California will be dealing with smoking whether it's e-cigarettes, cigarette tax, or raising the minimum age, or as well as the whether they can smoke in particular ballparks, etc. But my bill, what it's going to do, it's going to raise the smoking age from 18 to 21. And by raising the smoking age from 18 to 21, you're going to get less individuals or less young adults addicted to nicotine, which we all know will ultimately lead to death. It will not only get less individuals addicted to nicotine, but it'll also lead them in the future to not become smokers. It'll also have less cost on our state with regard to health care costs altogether. But an estimated 90% of lifetime tobacco users start before the age of 21, and 80% start before the age of 18. Early experimentation is largely driven through legal sales, 18 and 19-year-olds furnishing tobacco products to the younger teens in their social circles. This bill aims to place the age restriction above the social circle of most high school students. We can no longer afford to sit on the sidelines while big tobacco markets to our children and gets another generation of young individuals hooked on the product that will ultimately kill them. Let me say that again, that will ultimately kill them. California already has a 21-year age restriction in place for buying alcohol and purchasing certain firearms, because we know those are various dangerous activities. As a poisonous and ultimately deadly product, tobacco needs to be added to that list. And that's why I introduced the bill that will increase the age from 18 to 21. So at this time, it is my pleasure to introduce my colleague in the State Senate, Senator Mark Leno, who will talk about SB 140. And thank you very much for your time and consideration.
Thank you, Senator Hernandez, and it is a great pleasure to join all of my legislative colleagues today to address this issue, which each in our individual ways addresses a very serious health crisis and potential unfolding of a new health crisis. And that is why I'm authoring this bill with regard to e-cigarettes. All it will do, it doesn't ban them, doesn't impede innovation, it doesn't do anything other than regulate them as tobacco products. This is a very fast-growing industry and it is wholly unregulated. And we see the greatest growth in use of e-cigarettes among middle and high school students. Middle and high school students who have never smoked a cigarette are now smoking e-cigarettes. Even though it is illegal in California, thanks to the leadership of our former colleague Ellen Corbett, to sell e-cigarettes to minors. Nonetheless, the industry markets flavors such as Mountain Dew, bubblegum, and other sweet, attractive flavors to children. They are ingesting nicotine, and we've seen this all before. Big tobacco always looking for what they consider and market as a safer delivery system for their nicotine, which is addictive and deadly. We've been through this before. The risk of seeing a whole new generation of Americans addicted to nicotine should concern everybody. The misery, the suffering, the loss of life and illness, and the huge multi-billion dollars of costs to the taxpayer to deal with all the negative health effects of nicotine. And very quickly, about a year ago, Altria, which sells Marlboro, introduced the Market 10 e-cigarette brand. It increased the concentration of nicotine by about 65%. Blue e-cigs increased their nicotine content by 50%. Enjoy, which only makes in-cigarettes, is using a pharmaceutical ingredient in a new version of its device that's supposed to increase vapor absorption in the lung and elevate nicotine delivery to about 70% of a cigarette, according to their company data. Wells Fargo has researched and estimates that within 10 years, 75% of the e-cigarette market will be owned by Big Tobacco. We've been through this before. Are we going to let ourselves be fooled again? That's why we're supporting this e-cigarette regulation bill. Thank you.
Great. Send the freshmen to follow all of that, right? I'm Tony Thurman. It's my pleasure to represent the 15th Assembly District, the cities of Oakland, the cities of Richmond and Berkeley. And it is a pleasure to stand before you with my colleagues in the Assembly and the Senate who are taking these great stands today. And for those who've shared their personal stories about how they've been impacted by cancer and tobacco. I want to thank the Save Lives Coalition and thank each of you for being here today. My story is part personal. I lost both of my parents to cancer. Neither one of them smoked cigarettes, but I can tell you, having lost both parents to cancer, it is something that I would not want to see anyone go through. Our bill, AB 768, makes the connection to how cancer and tobacco can impact young people. Specifically, it's a ban on chewing tobacco and smokeless tobacco in the major league stadiums in California, and of course there are 5. We're making the case that young people are deeply impacted by seeing major leaguers chew tobacco or use other forms of smokeless tobacco. I know for a fact, again, I said it was personal. When I was a kid, I loved baseball. And when we played baseball, we tried to do the things that we saw our heroes do. We packed anything into our mouths that we could. We didn't have tobacco, but we pretended that we were chewing it and spitting it. It was messy, I'll tell you that much. But we were doing the things that we think that kids do today. And every year, 535,000 young people try chewing tobacco for the first time. And 14.7% of young people are using chewing tobacco. And we think that there is a direct link to what kids will see, and that's why we think that we should be banning smokeless tobacco. That's why we're proud to be part of this conversation. We're glad that people are listening. Our bill passed through its first committee yesterday, and the Arts and Entertainment Committee has passed through and is now moving on to the next committee. And obviously we're involved in the conversation to say that we think that there's no place for smokeless tobacco in baseball. We're calling it the Tobacco-Free Baseball Act, and we want to continue the conversation. And we're saying that all 5 of the stadiums for across California, for the Oakland A's, the San Francisco Giants, Los Angeles Dodgers, San Diego Padres, and the Los Angeles Angels of Anaheim, that there would be no use of smokeless tobacco anywhere in the stadium, on the field, in the clubhouse, anywhere that young people might see. And we're glad to be able to support the bills today that you heard from Senators Leno and Hernandez and Pan and Assemblymember Bonta. And now we're all prepared to take your questions. Thank you very much.
Okay, so again, I want to thank everyone for being here, and we're happy to answer any questions from the press.
Tobacco tax has been tried over and over again. Every year it's defeated. What's different this year?
I think what's different this year is that one is that we're focusing the tobacco tax on the costs that are produced by tobacco itself directly. So we are looking at focusing the funds, and proud to be working with Assemblymember Bonta on this to both address the trying to prevent tobacco use, and that's really the main driver, but also to help mitigate the cost that tobacco have actually cost financially to the taxpayer, and of course certainly to the health of the people who smoke. So there's a cost that taxpayers are bearing because of tobacco, and I think it's certainly reasonable to ask that the products that have created those health problems and have incurred those costs to the state, that at least a portion of it, this $2 pack isn't going to cover all of it. It's only cover a fraction of it. At least some of that can be recouped, so that the state can be, so that it's not borne solely by the taxpayers. That the tobacco companies have to help pay for some of the damage they're doing.
I don't have that exact figure, though we do know that the market's growing twofold in the past 3 recent years to over $2 billion today. So Clearly, the e-cigarette folks would tell you that they're fighting big tobacco. In fact, there is every reason to believe that they're in this together, because the e-cigarette folks were the innovators. They've got what big tobacco has always been looking for, their holy grail, a so-called safe delivery system for their addictive drug. And so to the degree that the market can grow unregulated, the innovators will benefit when the big guys come in and buy them up. So there are great financial incentives for both sides.
And have we seen that happen so far, where big tobacco has bought any big companies so far?
It is happening as we speak, and according to Wells Fargo, 75% of it within 10 years will all be in big tobacco's hands.
Now, are these e-cigarettes, are these the same as these vape shops? The lay people
Oh, sure. So the common parlance is vapors, vaporizing. It comes from vaporization. The suggestion is that the emission is just vapor. What comes to your mind? Just water droplets. It's not vapor. It's aerosol. And the difference is aerosol is made up of particles. And the California Department of Public Health has identified 10 carcinogenic particles in the emissions coming from these vaping devices. 10 chemicals that are listed on our Prop 65 list of dangerous chemicals. And that is why we think, again, that these products should be regulated as tobacco products, because the secondhand effects are just as serious when nicotine is burned as when it is heated or vaporized.
Any other questions? Yes.
Yes.
So if those 3 years between 18 and 21 are not where, a lot of people are first starting smoking, and, what is the thinking behind why that raising the age to 21 is going to make a significant difference?
Well, there was a recent study that was just produced by the Institution of Medicine that looked at 19, 21, and 25, and the study showed that age 21 was the most efficient or the best age, which would reduce the number of individuals that would be addicted to nicotine. Also, if you are 16 or 17, you're more likely to have somebody purchase illegal cigarettes for them because they know somebody who is 18. So somebody, if we raise it to 21, that 15, 16, 17-year-old, that social sphere is going to be reduced significantly, and a 21-year-old is less likely to purchase the cigarette for them. It's also been noted that if the younger you start, the brain development has a higher tendency to be addicted to nicotine, and therefore if you start at a younger age, therefore you're going to be most likely a lifetime smoker.
Great. Any other questions? All right. Sure. Yes.
Have you guys heard anything from players? Have they come up to you or told you anything in particular? I mean, this is going to be tough for not just players that play in California, but coming to business and play a game. It's part of their routine.
We reached out to the Players Association. We said we'd come to spring training and talk about it. We didn't get invited, but but we've reached out nonetheless. Look, baseball lost a baseball champion last year in Tony Gwynn, who at the age of 54 died from salivary gland cancer. And he was pretty vocal that his diagnosis was due from his use of chewing tobacco. Curt Schilling, World Series pitcher, who has been diagnosed with oral cancer, talked about 30 years of chewing tobacco as being the reason why he has oral cancer. So there's a clear connection. We've reached out to the Players Association. We're in conversation with them about it. Major League Baseball has said that they would support a ban on baseball, but we've reached out to the players. We think that, it's a fact that smokeless tobacco and chewing tobacco can cause all kinds of cancer, oral cancer, esophageal cancer, other forms of cancer. And it's a fact that kids do what their heroes do, and so we're making that connection. directly with the Players Association, with Major League Baseball. We're willing to talk to anybody, but we want to make sure that people don't avoid the facts, that there is a direct cause to cancer from use of chewing tobacco and smokeless tobacco, and we don't think that kids should see that and develop that habit.
Have you gotten a player to be the face of this legislation by any chance?
We've had some players who are retired speak in favor. We've been invited on a lot of interviews, radio interviews, and you can imagine we've heard the gamut of conversation. But generally, no one can deny the fact that when you say that 500,000 young people between the ages of 12 and 17 every year try smokeless tobacco, it's irrefutable. When we've had the chance to talk to young people, we had some future major leaguers as young as age 10 talk about how much they look up to their baseball heroes, and they don't want to develop the habit of chewing tobacco. We know that it's just an irrefutable fact that there's a connection. No one has been able to refute that this is a good thing. To keep kids from developing cancer is a good thing, and that's the lane that we're staying in, and we're going to keep pushing, and we'll talk to everybody, and as I say, we're engaged in conversation with both Major League Baseball and the Players Association on that front. Thank you. Thank you.
Thank you. Thank you.
Thank you so much for bringing